And you know, for many rural communities, the local hospital isn't just a place for care. It can mean the difference between minutes and miles.
Tonight, 11 Alive consumer reporter Eliza Lucas reveals how a West Georgia hospital is using a little-known tax credit to keep critical care close to home.
Here in Bremen, Higgins General Hospital is a lifeline for locals.
People come here if they're having chest pain. People come here for outpatient diagnostic imaging. We have a primary care clinic.
Heather Stitcher is a hospital administrator who says access to care is everything in a rural area. Just as critical, she says, is a little-known tax credit that brings millions of dollars through these doors.
So these funds provide a mix of critical infrastructure, equipment, patient care upgrades that quite honestly would otherwise be very, very difficult for a rural hospital to afford.
Georgians can redirect a portion of their state income taxes to support rural hospitals through the Georgia Heart Program. With 50 eligible hospitals statewide, taxpayers can also choose where that money goes.
You're making that decision of where those tax dollars that you're going to pay anyways get to be spent.
At Higgins General, contributions helped upgrade lab and imaging services and funded a mobile mammography bus. In 2024, lawmakers increased the program's contribution cap. Assigned leaders say the program is working.
The dollars that are contributed to the Georgia Heart Program are available immediately to these hospitals for spending, and in a lot of cases, they're keeping the doors open.
A recent state audit found the program helps fund infrastructure, staffing, and services, and cuts down the risk that vulnerable hospitals could close. With around $26 million worth of tax credits still unclaimed, and the deadline December 31st, hospital leaders say every dollar matters.
I've witnessed that critical impact that we make, and having this available here versus having to drive 45 minutes makes a difference in someone's life.
Liza Lucas, 11 Alive News.
The audit also found taxpayer-directed giving can make public spending more efficient since the dollars are better aligned with local needs. You can learn more about the Heart Program and the end-of-the-year deadline to apply right now on our website, 11alive.com.